Hey guys, my name is Jeb Smith. I'm a PTA here at Premier Physical Therapy. Been here for about 2.5 years, and I want to talk to you today about something we call blood flow restriction training. What blood flow restriction training is it's a methodology we use to help increase the motor unit recruitment during exercise. So if you've just had a surgery like a total knee replacement or an ACL repair, maybe even a rotator cuff repair, and you're not able to do a whole lot with that body part yet, we can use this methodology to help you exercise more efficiently in those times when you aren't able to do as much. So what BFR kind of does is it's a cuff we put on your arm or your leg, and we occlude some of the blood flow going to that extremity. What this causes is this causes those muscles to work harder. The other thing it causes a biological change, increasing your body's natural hormone production that helps your tendons, ligaments, and muscles recover. So especially if you've had something like an ACL or a rotator cuff surgery and those things are weak, this will help them recover faster, okay? So what we've got today, we've got CJ here, and we're gonna make CJ do a little bit of work for us so you kind of see what the blood flow restriction's about. So this is our machine, and we've already got the pressure set for CJ. Everybody's pressure's personalized since not everybody's the same. So we've already got CJ set up, and as you can see here, we've got the cuff on the upper part of his leg, okay? So all CJ is going to do for us is he's going to do some straight leg raises. So I'm going to inflate this cuff. You'll hear the machine going, and he'll feel it squeeze his leg, and he's just going to raise that leg straight up and down for us. So a lot of you have probably done exercises similar to this in therapy, especially if you're a knee or hip patient. So right now there's not even any weight on CJ's leg, and CJ's a pretty strong guy, okay? So he's probably already feeling the effects of this. Normally him just raising his leg straight up and down wouldn't be a big deal, but when we cut off some of the blood flow to that lower extremity, everything below it has to work harder to make those exercises happen. One of the other things this does is it can also help reduce pain post-surgery. So if you're a total knee replacement patient who's having a lot of pain, a lot of swelling, this can actually help with that. We don't use this for all your exercises. We usually pick 2 or 3 exercises and go from there, and then we will progress away from it eventually. But we really like this in the early stages of recovery to help keep you from losing a lot of that muscle size and strength that sometimes comes along with some of those more major surgeries. So as you can see, his leg's already starting to shake just a little bit, and he's about, how many reps in? 20. About 23 reps in. So he's gonna get to 30 and we'll let him take a break. There we go, how many more? 27, 28, 29, and 30. So we'll go ahead and deflate it. Now normally we would leave that inflated and he would do 3 more sets of 15, but this is just to kind of get you an idea of what's going on with it. If it's actually, I can already tell there's some increased swelling in that quadricep muscle, which is what we want. That's what we're looking for out of this. So this is a very useful tool. It's something we started using about a year and a half ago, and we've had great results with it. Like I said, we can use it for strengthening, we can use it for endurance, we can even use it to reduce pain in some of those sites that you may have had surgery on. So that's just a small example of what the BFR does and what we use it for. Like I said earlier, we can use it on the arm or the leg, and it doesn't necessarily matter what you've got going on. It's also for non-surgical injuries as well. So if you're somebody who's having elbow pain, wrist pain, we can use that and help with those issues you've got going on as well. So come down and see us and try it out.